You know, folks, when it comes to feeling good, you really want to make the right decisions, especially when it comes to something as important as hip surgery. So let's join Courtney again with more from the experts from Catholic Health at St. Mary's Hospital.
Are you someone that struggles with hip pain? Maybe you've contemplated surgery, but you're unsure of where to go or who to turn to. Well, this morning we take a trip to Lewiston, and we're here at Mount St. Mary's Hospital catching up with Dr. Kafai and physical therapist Kristen Barnard. Thank you so much to the two of you. Good morning.
Good morning. Thank you.
If someone is experiencing discomfort, when should they seek treatment?
We usually recommend activity modification first, and if they try Tylenol or other forms of anti-inflammatories. But if the pain is persistent and if they are at all concerned, then we're more than happy to take a look at their hip.
Kristen, doctors usually prescribe physical therapy as treatment. What does that involve?
Well, something unique to St. Mary's is we offer a prehabilitation program to patients that are going to be having a hip or joint replacement. And that gives them an opportunity to get back up and moving and get some strength and some endurance back in them before they have the surgery. Also educate the patient so they know what to expect during the surgery and rehab process.
Once a patient has received physical therapy, when is it time to consider hip replacement surgery?
Well, first of all, we have to confirm the diagnosis, and ultimately our role is to educate the patient, provide them with information, and what we're looking into is, once we confirm the diagnosis, how much is the pain, is the condition bothering them? If it's affecting their daily function, for example, they can no longer walk as much as they like, if it's really affecting their quality of life, then that's when we consider a total hip replacement.
Well, Dr. Lai, talk to us about some of the options that you provide.
There are different ways of doing a total hip replacement, and first of all, what I'd like to say is that total hip replacements are very successful surgeries, and majority of the time it helps alleviate the pain and also improve function. How we get there depends on the different the different approaches that we approach the hip. For example, traditionally, a lot of physicians would perform the hip replacement from the side or from the back through to the hip joint. More recently, and it's gaining more popularity because of its advantages, is the anterior hip approach, and that involves approaching the hip from the front. And what the advantages include, it's what we call a muscle sparing procedure. So instead of cutting the muscles or detaching them from the bone, we basically spread the muscles apart and approach our hip without damaging the muscles. And the advantage of that is, because the muscles are not damaged, you can recover quicker and postoperatively less pain. And patients, in my experience, tend to like this approach.
For our viewers at home who are suffering with this type of pain, how do you know if hip replacement surgery is right for you?
Again, it's based on the quality of life, and once we confirm that your diagnosis of arthritis, and we assess if it's affecting your function. Essentially, if you're at a point where you feel that my pain is bothering me on a daily basis and it's affecting the things I used to enjoy, then that's time to come talk to your doctor regarding potential total hip replacements.
Kristen, where can our viewers go for more information on this type of surgery?
Well, you can visit the Catholic Health website, or Dr. Lai and I are going to be speaking at the 4 Point Sheraton, Niagara Falls, and we're going to have a dinner complimentary if you want to join us, and that's January 29th.
So this is an opportunity for Western New Yorkers to come out, meet the two of you, and learn about all the different options that can help them live a happier and healthier life.
Absolutely, and they're welcome to ask questions. There'll be a breakout session at the end.
All right, thank you so much, the two of you. Thank you for having us here at Mount St. Mary's Hospital in Lewiston. If you are a loved one or contemplating hip surgery, this is the place to be. Contact Catholic Health.